Um, so maybe the first one I'd like to ask you about, Adam, is macular degeneration,
hmm
or what's called AMD, also age-related macular degeneration. So can you tell us, like, what is it? What are some of the symptoms of it?
Mm.
Um, and like how are we treating it these days?
Yeah, so age-related macular degeneration is a specific type of macular degeneration. It's the one we think about the most when we refer to macular degeneration. And an age-related just simply meaning that compared to a juvenile macular degeneration, which is what we see in kids. So with age-related macular degeneration, um, one of the biggest risk factors is age. And part of that is because of dietary um, input throughout our life. Part of that is to do with UV exposure. Part of that can be to do with things like smoking. So the longer we live, the more exposed to some of these external factors. But it's not just that, it's also changes that occur naturally that are kind of accelerated.
Mm,
So with macular degeneration, there is a buildup of waste on the inside of the eye behind the macula. And the macula is the center of the back of your eye. So whenever we're looking at something, it's the macula that is
mm,
directed at what we're looking at and what's doing all the work. So there's a buildup of waste, and normally our body is able to remove that waste.
mm,
And so there's the buildup and removal, buildup and removal. One of my colleagues put it quite nicely that imagine the garbage disposal is meant to come every week, but is now coming every 2 weeks. Then maybe comes every 3 weeks. That garbage is going to build up. And that's kind of what happens with macular degeneration. We have a buildup of waste behind the macula,
mm,
or in the macula, but at the back, the outer layers. And so when there's that buildup of waste, eventually we get to a situation where there's a blood flow is not able to properly nourish those outer layers of the retina. So we have the blood flow, we have a waste in between, and then we have the outer layers. So if we can't nourish those parts of the eye, then they start to break down and degenerate. This process can take quite a few years to get to some really significant levels. But what we do know is that in the Western world, and such um, macular degeneration is the leading cause of low vision and blindness.
mm,
Um, in less developed nations, it's not. We're thinking about things like cataracts and
mm,
refractive error, but certainly in the Western world, macular degeneration. So in early stages, um, someone might not actually notice anything because there's no actual change to their vision at that point. Usually the symptoms are going to occur when we start to see something that's a little bit different. So it might be that
mm,
there's a little bit of blurriness in the central vision, or it might
mm,
be not blurriness, but a bit of distortion, um, lines that appear a little bit wavy. The door frame is not quite straight anymore. Those sort of things are potentially symptoms of macular degeneration. They're not exclusively related to macular degeneration. We can get those sort of symptoms with any sort of macular change because the macula is central vision. So if there's some level of distortion to the health of the macula, then those sort of symptoms can occur. But as we get to more advanced levels of macular degeneration, we might notice things like reading becoming a lot more problematic. And that won't be necessarily corrected with glasses. Certainly, updating glasses prescriptions will help, but there's a limit to what we can do with glasses there. With macular degeneration, we might look at different types of glasses, or we might look at high-powered reading glasses, or in some cases, low vision aids that can help just to magnify things. And that's really the crux of it. When we have macular degeneration, we can't really, certainly in advanced levels, we can't really define small details. They become quite difficult. And so reading becomes a problem because a lot of reading material is small. So a lot of people with macular degeneration, particularly when it gets more advanced, may benefit more from large print books. And then eventually they won't work so well anymore, and we might have to go to audio books, for example,
mm,
or low vision aids.
mm,
But certainly, it's something that is a bit of a journey to get to that point. Um, and symptoms aren't always that cut and dry. It's not always a sudden change. Sometimes it's a gradual change, and with gradual changes, our brain can be very good at filling in some of those gaps that may occur. So the best thing to do would really be having regular eye tests, because
mm,
a regular eye test will allow us to see inside of your eyes, because there's something like uh, close to 1 in 7 Australians over the age of 50 will have some level of macular degeneration. But a lot of those are in the early stages that they won't know. Now, just because you have macular degeneration doesn't mean we have to quickly do something, because it's not always to that extent. And oftentimes we can't do anything because there is no treatment for one of the forms of macular degeneration. So we're looking at environmental factors and modifiable factors, things like diet and exercise, things like smoking, and things like UV protection. Although even in that, there's a bit of nuances. When we get to more advanced stages of macular degeneration, though, things can be a little bit different. And this is really where it depends on genetics. If we have a dry form of macular degeneration, then there is a breakdown of those layers, and we call that geographic atrophy. And so what happens there is that those layers have broken down, and our vision in those parts of the macula just are not providing really good functional information anymore, because they can't, because those layers that have broken down are sending information along a cascade pathway. But if there's a break in that link, then it can't send that information really well. There is no treatment for geographic atrophy or dry macular degeneration. It's all about monitoring. It's all about managing the symptoms as best as we can, managing lifestyle, through a few different things that we can do, such as low vision aids, as best as we can. The other form of macular degeneration we refer to as neovascular macular degeneration, or wet macular degeneration, as some people think of it. And the reason we think of it as wet is because there is bleeding. Neovascularization basically means that there are new blood vessels. When we have new blood vessels, there's going to be a lot of leakage in blood from that, because the eye is not supposed to create new blood vessels later on. When we're developing in our mother's womb, we're supposed to have those blood vessels be new and being formed, but they're just not structurally sound if they're being produced really fast through these age-related macular degeneration changes. So we have all of this bleeding, and there is treatment for that, but it doesn't stop the macular degeneration. It's all about trying to reduce that bleeding and to reduce those continued growth of new blood vessels, and that's with injections inside of the eyes. And so someone who has to have injections inside the eyes would start off by having it quite regularly, potentially once a month for a little while, until things start to stabilize, and maybe extend it out to 1 every 5 weeks, but then maybe every once every 6 weeks, 7 weeks, 8 weeks, until the ophthalmologist believes that the macular degeneration, or at least the bleeding, the neovascularization, is under control and stable. But it is a long journey. There's always work being done into macular degeneration, because it is such a relatively common cause of low vision and blindness in Australia. So there's genetic work that is being done to try and treat the dry form or geographic atrophy and other forms of neovascular macular degeneration. But it's a continued process, and there's a lot that we can still uncover as technology improves and as medicine develops.